So for the assignment, I'm having Matthew help me, and he's going to be the person that demonstrates. So for the first injury is going to be back pain. So to get specific with it, it is going to be a compression injury, which typically happens from overuse, just constant pressure. So in softball, a pitcher, when she stands up and strides and lands, a lot of her weight is just going to be on her left leg or right leg if she's a lefty. And it's just going to be that constant compressing of the spinal disc. So here are some ways to prevent that and to help rehabilitate it if it does happen. So the anatomy of it is going to be the vertebrae, which is along the spinal column. The lumbar is most associated with the pain because that's where a lot of the load gets hit. And then the erector spinae is the muscles that surround it, which are going to have that kind of just fatigue and or inflammation from being used a lot. And then the legs and glutes, just because those are part of that striding motion. And then the abdominals and hip flexors, if those are super weak, those are not going to help the issue. So for the exercise, the preventative exercise will be a glute bridge. So Matthew is going to get on the floor and demonstrate the glute bridge. This is Matthew performing a glute bridge. So his back is completely flat on the ground. His feet are even with each other, knees are up, even with the ankles. And he's going to go ahead and bring his bottom up into that position. Perfect. So here he is working his lower back, his glutes, and his hamstring. So that whole posterior chain. Go ahead and relax. So this exercise should be done for about 2 to 3 sets, 10 reps with a 3-second hold at the top. So as he goes up, he should be squeezing his glutes here and having that 1, 2, 3-second hold, and then relaxing, coming back down, getting ready for that next rep. So the first exercise for the rehabilitative is he's still going to be laying in that position on his back. He's going to bring his knees up towards his chest, using his hands right behind the knees on the hamstrings, and is slowly going to bring them in, helping decompress that spine, and then holding that for about 2 to 3 sets for about 30 seconds to a minute, depending on how compressed that spine is. And then from there, if this does get too easy for the individual, he can release his hands, have his knees about 90 degrees with his feet pointed up in that flex position. And then he's going to drop his hips 90 degrees down, slowly and controlled until they hit the ground. And then slowly bringing them back up and moving to the other way. And that's just going to help decompress the spine and release some of the tension and load. And that would be a rehabilitative exercise. So for the treatment, there could be, depending on how severe the compression injury is, it could just need an x-ray just to determine that no discs or any of the vertebrae are out of alignment or herniating or anything like that. So if it's a low-grade injury, you can just rest, ice, compression, elevate. Well, you can't really elevate your back, but relaxing, not doing anything strenuous with it. But if it is a higher grade injury where there is something out of place or out of alignment, you will most likely need a brace and or surgery depending on the severity. For the second injury, it is going to be wrist tendonitis, which is typically an overuse injury. And as a softball player or baseball player, as you are throwing overhand, there is a lot of flicking motion. And for softball, it would be a lot of underhand spinning motion to try to get certain rotations on the ball. So there's a lot of turning, twisting, coming back, anything like that to manipulate the ball to do what you want it to do before it gets to the plate. So typically it is an overuse injury, inflammation of the tendons and or muscles of the wrist. So a lot of extensor or flexor tendons will become inflamed, causing it to have that tendonitis issue. And the way that it can be prevented would just be, so for the preventative exercises for wrist tendonitis, there is flexion, extension, radial deviation, and ulnar deviation. So you will have your client have their hand on a flat surface. So in this instance, it will be a table. They will be bringing their wrist up, using the extensor muscles, kind of flexing them or hyperextending them towards the sky. So that will go for about 2 to 3 sets, 10 reps each, and then having them flip their hand over where their palm is facing up, and then using the flexor muscles to bring their hand in. And same thing, 2 to 3 sets, 10 reps each. And then either with their hands still facing up or facing down, they will go into radial deviation, which is the thumb side, bringing their hand in, and then ulnar deviation going to that pinky side. Same thing, about 2 to 3 sets, 10 reps each. And then for the rehabilitative exercises, it would be with their hand facing down, but off the table. So they will hold it out in front of them, and then they will be using their other hand to pull their hand down off the table. So pulling that down, really trying to get a good stretch and some range of motion on those extensor muscles, and then coming the opposite way, bringing their palm facing out, fingers back towards their hand, stretching out the flexor muscles and trying to get more range of motion there. And then that should be held for about 2 to 3 sets, 30 seconds to a minute each. So treatment for wrist tendonitis, depending on the severity, most of the time it's just rest, ice, compression, elevation, just to where there's not as much use and tension on the hand. Depending on how inflamed the muscle is or how inflamed the wrist feels, you can use over-the-counter medications such as Advil, Tylenol to help with any pain or inflammation. If it does get more severe, doctors could prescribe a brace or a compression sleeve for the wrist and thumb area just to make sure it is not getting overly swollen. And lastly, for the third injury, shoulder tendonitis, which is very common, especially in softball and or baseball athletes because of that repetitive overhead throwing motion. Not as much common in pitchers' underhand, but if there is too much overuse, it is an overuse injury. It can develop over time. It is typically an inflamed rotator cuff and or biceps, the rotator cuff consisting of the infraspinatus, supraspinatus, teres minor, and subscapularis. So some exercises that can be preventative for rotator cuff injuries is you will need a thinner band. It can be like a glute band, a booty band, or just a regular band that you can get at the doctor's office that they cut. So for this, it's going to be a lot of external rotation, and you will either need to place this on something to where you don't have to focus on holding it as much or have someone else hold it for you. So for the exercises with that external rotation, the individual is going to take either one of their arms. In this case, it is going to be his right hand. He's going to go ahead and grab the band and perform an external rotation while I hang onto the band, trying to make sure his elbow stays almost intact with his side and is just using the posterior muscles of the rotator cuff to perform this exercise. And then the second exercise, he will be with his arm up 90 degrees. Same thing here. No, stay back. Push this there. And then he's going to be pulling that band back like this. You will not have a lot of movement. A lot of people do like to drop their shoulder, or they will come in with their arm here and have it not be 90 degrees. Or they will come out too far, and then that is just going to put a lot of tension on the shoulder. So you do want to make sure you are staying 90 degrees here. And then the last exercise, go ahead and get a little lower, coming down. This is going to work more rear delt, which is kind of sisters to that rotator cuff. And you're just pulling back, almost like a lat pull down, but exceeding the range of motion. Just there, coming back. All of these can be performed at 2 to 3 sets, about 10 reps each. So for the preventative exercise, we do not have a PVC pipe, but we do have a softball bat. So you can use either one, something that is long enough and that you can get your hand around. For this, it is going to be performed about 30 seconds, 2 to 3 sets, 30 seconds to a minute each. So what the individual will do is grab it with their hand without breaking a fan and pulling it back to where they really feel that tension. They do try not to go back too far and pull it because that will tear something if it is moved too quickly. Holding it over time, they should be able to increase their range of motion, being able to pull this barrel of the bat further and the knob further away, giving them a little bit more of a stretch. Same thing, about 2 to 3 sets, 30 seconds to a minute, depending on how comfortable they are with that stretch. And then lastly would be just an across the body exercise where they're just getting more range of motion on that arm. Same thing, 2 to 3 sets, 30 seconds to a minute each. For treatment, stretching, physical therapy, visiting a physical therapy office can help decrease any inflammation. if there is inflammation, rest, ice compression, elevation, just to make sure it does go away. And then taking a break and not using your shoulder as much also helps.